Welcome back to the show Talk with Your Doc. With me is Dr. Adrian Chan, and we are talking about breast cancer. Thank you, Dr. Chan. We were talking about mammogram and the screening test for the breast cancer. What is the role of MRI test in the breast cancer detection?
MRI is often used for screening of women who are felt to be at high risk of getting breast cancer. For example, the women who are carriers for BRCA1 or 2 mutations. Research has shown that using MRI of the breast in addition to mammogram increases the rate of detection and of breast cancer compared to mammogram alone.
So MRI is more sensitive than the mammogram itself.
It can be helpful and maybe more sensitive, I think, especially often in younger women where they have more dense breast tissue,
right.
And dense breast tissue decreases the sensitivity of mammograms.
Yes. So we do biopsies along with the mammogram, ultrasound, or with the MRI. And once the biopsy comes to the pathologist's desk, then we as a pathologist, we diagnose what type of cancer it is, whether it is in situ cancer, which is like a locally confined cancer, or whether it is invasive cancer, which has possibility of spreading to the different parts of the body. We also classify them as a lobular and ductal type of cancer. And then we do various types of tests on it, like hormone receptors, like estrogen and progesterone receptors. And one of the tests we do is HER2/neu test, and then we also do Oncotype DX test. So can you please tell us about Oncotype DX?
Oncotype DX is a gene expression assay. What it does is it measures the varying levels of expression of a group of cancer-related genes. And this information can be used to assess the risk of recurrence of a breast cancer. The test is often done in patients who have an earlier stage breast cancer that has the hormone receptors for estrogen and or progesterone and has not spread to lymph nodes. And it's often helpful for a physician in assessing further the risk of the cancer coming back to help them decide, for example, whether the risk is great enough to recommend patients having additional chemotherapy after the surgery to reduce the risk of the breast cancer returning, right. Or if the risk is low enough for them to just recommend anti-estrogen, anti-hormonal therapy alone.
Right. So once we diagnose the patient with the breast cancer, and a pathologist like myself will send you the report that patients has estrogen and progesterone receptors positive invasive ductal carcinoma. So what do you do next once this report of biopsy comes to you?
There's another receptor that is also helpful in assessing the risk of recurrence of the breast cancer, and that is HER2/neu.
HER2/neu,
which is a mechanism in the cancer cell that also can drive the growth of the cancer. And in approximately 20 to 30% of breast cancers, it is overexpressed. There's more of it than normal, and that increases the risk of recurrence of the breast cancer. Right. Women with HER2/neu overexpression positive breast cancers are often recommended to have chemotherapy plus a anti-HER2/neu antibody treatment called trastuzumab or Herceptin to reduce the risk of the cancer coming back.
Right. So now the surgical options, what are the breast conservative surgery, simple mastectomy or radical mastectomy with lymph node dissection? So who are the patients who get breast conservative therapy?
Breast conserving surgery with, say, a lumpectomy is these days often preferred for most breast cancer patients, as long as their breast cancer is not too large, right?
So what is the size limit for that? If somebody wants to preserve the breast and remove the lump, what is the size limit where they can go for?
It's not necessarily just a strict size limit for all patients. It depends on the size of the tumor, but also the relative size of the breast as well, right? For breast cancers that are considered fairly large, like locally advanced, and these may be breast cancers that are, say, 5 centimeters or greater.
5 centimeters.
Often, it's difficult to do surgery initially,
Conservatively.
and so people will be treated first with some anti-cancer treatment, chemotherapy, and then
They go for the
and
surgery.
then have surgery. But many breast cancers that are smaller, and maybe in
1
the range of
centimeter
2
or less.
centimeters or less, often can have surgery with a lumpectomy, and then followed by, or in addition to some sampling of the lymph nodes in the armpit to check for spread of the cancer there. And then after that, that breast conserving surgery, they would have radiation to the rest of the breast at a later point.
Right. So breast conservative therapy, say if somebody undergoes breast conservative treatment, surgical treatment, removal of the lump and the lymph node. So there are two types of lymph node surgery, sentinel lymph node and the axillary lymph node dissection. So can you please tell us about advantage of sentinel lymph node biopsy?
Sentinel lymph node biopsy is basically sampling the first one or few lymph nodes that cancer cells would be more likely to pass through if they travel, right? And it's often done to to save people from having to have a full axillary lymph node dissection where they remove a lot of lymph nodes.
So that full axillary lymph node dissection has associated problems. That's why we do this.
Right. It's often can cause swelling of the arm, lymphedema, which can be bothersome and impair one's ability to function with their hand.
So sentinel lymph node, by removing 1 or 2 lymph nodes, if those are negative, the likely that other lymph nodes are negative, right? So it prevents the radical surgery and the morbidity associated with it. So sentinel lymph node is a good procedure, and the chances of it being detected are 99%. Is that right? So 99%, if the sentinel lymph node is negative, the chances are that the other lymph nodes are also negative.
That's right. If there are no sentinel lymph nodes, involved with cancer, the likelihood of more lymph nodes being involved is felt to be low enough that they don't need to have a full axillary lymph node dissection. And in fact, these days, often if you have a tumor that is not very big and just 1 or 2 sentinel lymph nodes involved with cancer, then you may not need more lymph node surgery as well.
Right. Now we talked about the treatment options. Now, what is the survival of the patient with the breast cancer once he or she has been diagnosed with the cancer?
Well, the survival depends on the stage of the cancer, right? The stage is a description of, in general, how extensive the cancer is in the body. There are in general 4 main stages, with 4 being a situation whenever the cancer has spread to other parts of the body, other organs like lungs or liver or bone. Unfortunately, those breast cancers are not curable. Right?
Stage
can
4
be treated, but not curable. But stage 3, 2, and 1 are curable. And the lower the stage, the higher the risk, higher the likelihood or chance of being cured, with a fairly good chance of cure for stage 1 or stage 2 breast cancer.
So early diagnosis is the best way to fight against the breast cancer, and reducing the risk factors, lifestyle factors, and early screening methods like mammogram will be really useful to reduce the incidence of breast cancer in the society.
Yeah, I agree. Prevention with these lifestyle changes, like avoiding too much alcohol, avoiding smoking, and regular exercise,
weight reduction,
having a good healthy weight, and perhaps a diet that's lower in fat and rich in lots of fruits and vegetables. These things may help prevent breast cancer and other cancers. And then in addition, some screening tests, checking for cancer when you're healthy, like with the mammogram for breast cancer, can also potentially help catch the cancer at an earlier stage where the chance of cure is more likely.
Thank you, Dr. Chen. Thank you for coming to the show.
You're welcome. My pleasure.
Appreciate it. Please come back for the next edition of the Talk with Your Doc show. We are going to talk about the skin cancers. Thank you so much.